COVID-19 pandemic, lessons learned and the new normal as I see it. Prevention is better than cure. This saying has proved its worth in the current unprecedented healthcare crisis which has taken the world under its siege. COVID-19 has been a curtain raiser for the anesthetists around the world as they are working as frontline warriors. Anesthetists need to break transmission of infection at various levels according to the new guidelines for hospitals and OT. Personal safety while treating patients is of utmost importance. PPE has become an essential requirement to protect healthcare workers from aerosol generating procedures. Education methods have also been redefined. Survival of the fittest stands true in the current global pandemic. Quick adaptability to the fast changing scenarios and information is the new normal. Thank you. Dr. Chetna Agarwal, India.
Good evening, everybody. The COVID wave has hit the world and our lives have changed. Anesthesiologists are one of those who have seen some of their darkest days during this COVID pandemic. It has affected them physically, emotionally, and financially. It is said that every dark night is followed by the bright day. Similarly, the dark COVID days will soon come to an end. But like soldiers returning from war, it will take time for us to process everything and heal the wounds of this battle. Getting back to routine OT and ICU work will be a welcome change for all of us, but it is now on the horizon. No one really knows what the new normal will look like, as it is going to be new for everyone. It is certain that COVID is going to stay with us for some time and we have to learn to live with COVID times. COVID has been the dawn of a new beginning for anesthesiologists and the subject of anesthesiology. Life for anesthesiologists may never be the same again. Thank you.
Respected judges, office bearers of AORA and AOSRA, teachers and dear friends, Namaste. Thank you for giving me this opportunity. We human beings or Homo sapiens are supposedly the most evolved species on this planet, but the pandemic which we experienced this year showcased our vulnerability. SARS-CoV-2 virus, which is of the size of 0.1 micrometer in diameter, created havoc of such proportions that there were unimaginable number of deaths and unexpected financial losses which was experienced by each and every country. Social distancing and wearing masks became the new normal way of life. Clinicians are still fathoming the pathogenesis of this mysterious disease caused by this virus and are coming out with management strategies almost every day. But we human beings are fighters by instinct, and I am sure very soon we will tide over this pandemic and start living a normal life like before. Thank you.
A delightful evening to the finest in anesthesia. Besides tons of patience, discipline, and a sea of change, this pandemic brought a new phrase as the webinars zoomed in. It was, please unmute yourself. As it became my mantra, I, Dr. Kiran from Nasik, unmuted myself in this global essay. As I speak, I become accountable so that when this storm passes, we don't forget the lessons and opportunities it brings to fix the fallacies, to let go of limitations of the past, and as doctors unite, unmute, and work relentlessly to heal the healthcare system so that none of the lives lost are meaningless. Still raw, still trying to land, but definitely unapologetically unmute. That's the change this pandemic brought.
COVID-19 has shaken the world out of its make-believe paradise and turned lives topsy-turvy. The conventional centuries-old medical practice methods have become unsuitable for the current environment, and physicians struggle to discover new alternatives. Anesthesiologists have lost the comfort of air-conditioned operating rooms and now sweat under alien-like PPE attire. When wearing N95 masks, we get breathless climbing stairs. Light-hearted OT jokes are passé, and so is the constant OT chatter. We can't appreciate the twinkle in the eyes, the smile or the cheer on the faces behind masks, goggles and shields. Social distancing compulsions have ensured that doctors' lounges remain empty and coffee interactions are chronicled in the annals. Overall, the new normal has made OT atmosphere drab. We need to continually evolve with the new normal to achieve the adage of staying alive and staying safe.
Hi everyone. The new normal after COVID. You think the pandemic is over? I'm sure all of you will agree with me, no. And it's not going to be over for a long time. It's here to stay. So we all have to learn to live with it and also remove the fear from both from inside and outside and learn to work with the pandemic around. So around 8 months back when the pandemic started, everybody was so confused and scared and the whole world was in lockdown and everybody didn't know and there was so much of literature coming from all over the world. Gradually things have started opening up, things have become clear and lots of things have been created just to face this pandemic. And even at the workplace, even at home, we are becoming more comfortable now. You can see our youth taking a 360-degree turn and they are cycling down the road, they are jogging with the face mask on instead of spending time in the pubs and with their friends and gym. So they are adopting to more healthier lifestyle. Similarly for us also, we are also adopting the healthier lifestyle, like we are into meditation, pranayam, yoga, and that's what's the new norm. And at the workplace, similarly, the new norm is safe distancing, use of PPE kits, the face mask, and etc. etc. So many things we have adopted to, and that's what's the new norm.
With more than 40 million cases and 1 million deaths worldwide, this pandemic has become the defining global health crisis of our time. But this pandemic is much more than a health crisis. It's also an unprecedented socio-economic crisis. Ultimately, the pandemic will run its course, but our battle against communicable diseases would not be over after this pandemic. The emergence or re-emergence of other infectious diseases is a challenge that is truly perpetual, and our response to these challenges must be perpetual as well.